Hello everyone, I am Dr. Siddhartha Chakravarthy. I am from Vellore. I have recently joined Apollo Jubilee Hills or the Apollo Health City in Hyderabad. Today I will be talking about breast cancer. As you are aware that October is the breast cancer month. So as breast cancer is the commonest cancer in women in the world, and if you look at the urban India, it is like if Delhi, Mumbai, Bangalore, Chennai, it has become the commonest cancer in women. In rural India, still the cervical cancer is high, but because of this urbanization, change in lifestyle, breast cancer's incidence is going up rapidly. So, how do you know whether you are having a cancer and what are the symptoms of a cancer? Whenever a woman has a new onset of a lump, that is, whenever you feel any change in your breast, then you must get it checked with a doctor. Like symptoms of a breast cancer, if you say you can have a lump, you will notice a lump or any unusual finding. You can find a thickening of the breast, or you can have a nipple discharge which can be bloody and spontaneous. Then you have to get yourself checked with a doctor. Or you can have a swelling under your armpit or in the axilla, what we say, any new onset swelling in the axilla, you must show it to a doctor again. So these are by and large the common symptoms of breast cancer. The incidence of breast cancer probably becomes high when as you start getting older. Maybe in women they cross 40s and 50s, the incidence is high. But even younger women can develop breast cancer, and unfortunately in India, if you look at the incidence, it's high in women aged 40 to 50 years. It's a little unusual. In the West it is more than 50. So what are the risk factors of breast cancer? Being a woman itself is the biggest risk factor, and if you have a early puberty, that less than 12 years, and if you have a late menopause, then your reproductive period is high. In that case, the hormones estrogen and progesterone, they keep on acting on your body, and which can increase the incidence of breast cancer. That is one. And if you have a family history where if anybody in your family, if your mother or sister is having a breast cancer, then again your chances of getting breast cancer is high. There are some genes like BRCA1, BRCA2, some genetic mutations if you have in your body, then also your risk of developing the breast cancer is high. So there are other risk factors, like if you are having a late first childbirth, if you conceive after 30 years, then again your risk goes up. And if you take this hormone replacement therapy, if you take it for more than 5 years in a postmenopausal woman, then also the risk goes up. And what is protective is they having breastfeeding the baby. If you breastfeed for long, it prevents the breast cancer. Please encourage breastfeeding. And there are other risk factors, like if you take alcohol, and by and large smoking and other unhealthy, like if you are obese, these are other risk factors which try to have a healthy lifestyle, exercise at least for half an hour per day, or if not possible at least 3 or 4 times in a week, and eat healthy, eat a lot of fruits and vegetables. So whenever you notice a new lump or any lesion in your breast, please consult your physician. Around 80 to 85% of breast lumps are painless. Our breast cancers are painless. Only those 10 to 15% will have some mild pain. So any lump, please go consult your doctor, especially all women, and try to do self breast examination. What is self breast examination? I mean, you have to be aware of your own breast. So try to examine it once a month. Stand in front of the mirror. The right time to do is after your onset of menses, maybe 7 to 10 days. after the onset of your menses, you must examine your breast. That's the right time to examine. Examine them in front of the mirror and feel for any unusual lumps. Start and don't feel it, don't cup your fingers like this. The right way is to palpate flat and feel the entire breast. And if you notice anything abnormal, consult your doctor. So any abnormality, the first person to pick it up is you. So be careful and be aware of your own breast. If you have any lump, and what will happen, what will the doctor do to you if you have anything abnormal, then the doctor might examine yourself, and then he will do some investigations like mammography, and if required the needle biopsy, and then they will, if you are diagnosed with cancer, they will do the respective treatment. It can be in the form of mastectomy, or you can conserve your breast also. You don't have to do a mastectomy if you detect it early. There are other treatment modalities like chemotherapy, where they give some injections, and there are some other modalities like radiation. These are all a part of the treatment which your doctor will decide based on the stage of your cancer. So this cancer, if identified early, is curable. The recurrence will be less. Okay, so don't worry, I am not come here to scare you about breast cancer. About 1 in 8 only are breast cancers that we see in the clinic. 80 to 90% of the patients are benign. But any change in your breast, please consult your doctor is what I would suggest.